Ooh, Matthew Holt, more big telehealth news, and somebody has raised $380 million. We will talk about that.
Me.
Not you. On the other side, it's the March 2nd episode of Health in 2.0.
Okay, so how many companies did Teladoc buy on their way to becoming Teladoc? A lot.
Was it more than 5?
Oh yeah, I mean they bought like a company in Spain, a company here, and a company there. And
that's right. I forgot about the one in Spain.
BetterHelp. I read somewhere that BetterHelp, which is their mental health online thing itself, is doing $300 million a year. So we always talk about online mental health stuff, and that's that's just part of it. But I guess we're not going to talk about BetterHelp or Teladoc more than we already have done in the next bit because it's somebody else.
Somebody else entirely.
Right, should I start the timer?
Start it. Let's do this.
Here we go. It is. We are go.
All right. MDLive gets acquired by Cigna's Evernorth division. Mr. Holt, do we know how much? Do we know? What do we know?
I know nothing. They raised a couple $100 million. They raised didn't they raise like $50 million last September? Didn't they say they were going to IPO? They lied to us. They lied to us. Lies. And didn't Evernorth? You interviewed the guy from Evernorth because Evernorth is kind of Express Scripts and the other random stuff that they bought. So I guess the question is, so it's probably, they're IPO'd or SPAC'd out. They've probably got a couple of billion because they're around. So I think I would guess a couple of billion is the number. And the question is, what happens now with United and their deals with Amwell and Teladoc? What does Anthem do? Does all the plans just get one and start doing virtual care because they've already got providers? We'll find out.
Good luck, Doctor on Demand. All right.
I guess Lyle Berkowitz will tell us the answer, right?
Lyle. All right. Devoted raises $380 million. Huge amount of money.
Yep. So that is Ed Park from Athena Health. Todd obviously was CTO at HHS a while back, and then actually in the US. So the deal here is that they were building a kind of from the ground up, and they still are building from the ground up Medicare Advantage plan. They made a lot of fuss, raised, I don't know how much it was, several $100 million a while back, and then raised this to go dip more toe in the water. They initially said they didn't need to raise that much money, but I guess as they're building out, they're finding like Oscar and Clover and everyone else, they're building out this thing is expensive. They're growing a bit faster than Clover, which a lot of people think is not doing that well. Interesting guys. So good luck to them. We'll see how they'll happen. By the way, little secret, a bunch of small blues plans are invested in this as well. Not a lot of people know that.
All right. Medisafe gets $30 million. Sanofi led that round. What do you know?
Chris DeLuca finally started to splash the cash. Now he's over at Sanofi.
Hey, man, it's been a while.
Yeah, he's been surrounded red without doing much. What I know is that in 2014, Omri Shore, CEO of Medisafe, won Traction, which is a contest at Health 2.0. Therefore, I deserve 10% of everything. Just in case you don't know what Medisafe is, it's
medication adherence.
It's medication adherence, but they also build products with pharma around their drugs. Nice little business. Probably not a position.
January AI out of stealth mode with an $8.8 million raise, bringing the total to $21 million.
Well, so there they are. This is like a company called Levels. Remember them? We have featured a lot who, testing people's continuous blood glucose.
Yeah.
Is this stuff going to take on? Are people really going to figure out, where they are in the cycle? I mean, maybe some people aren't care about this, who have diabetes. We're groping towards that. Sounds like a lot of money for what I think is an experiment, but maybe it'll work.
You sound skeptical.
Or maybe it won't. I don't know. Invasive Ventures is in modern health and some other stuff. I'm not always a great admirer of their track record, but we'll see.
That's interesting. Do you think this devoted raise, I was going to ask you as a follow-up, that devoted raise, do you think that's they're going to end up going public?
Well, they've got to be thinking about it, right? But when they raised the money in the first place with A16Z and a bunch of others, I talked to Todd. I think off the record, on the record, who knows?
It doesn't matter now, Todd.
It doesn't matter now. I'm on the record now. But he basically gave me the impression that they were really in this for the long haul. and we're just going to keep raising. And, you know, and Oscar spent, it was only a couple of years back, right? Oscar spent how many years raising money before they haven't gone public yet? So yeah, they could SPAC out the way Clover did, but I suspect that they're more interested in the longer term play, and their capital is probably pretty patient. The real question is, the big picture question, which is Clover is facing right now, is it possible to build, you know, just got all of new fancy tools and new fancy techniques. Is it really possible to build a big new Medicare Advantage plan if your name is not Humana, United, Centene, whatever, right? And it's really hard to recruit people, and you can only recruit, you know, them every year, and they're only aging so much, and Medicare Advantage is growing, but it's not growing that fast. So this is not, you know, this is not, as I say, this is not Instagram.
This is not for the faint
get to 100 million users and sell out in a year, right?
Nope, it's not. Interesting. That's it.
Well, I mean, but having said that, right, Medicare Advantage is a place where there's a lot of sort of somewhat dodgy stuff in there, especially with risk adjustment, and that it's ripe for some good new people to come up with some real ways of saving some money, but also improving service, which is exactly what Todd and Ed said they're going to do. So I hope they're telling the truth.
Yeah, let's hope so. By the time I get there to the Medicare plans.
you're getting closer, but you're not as close as some people around here.
Nope, not as close as others. Nope, not at all.
Hey, in Biden's plan, don't forget, they said they were going to bring the Medicare age down to 60. It could be 3 years away.
3 whole years. That's it. Oh my God.
More like 8.
Somebody should start prodding the Park brothers along.
I'm ready here to sign up.
Oh my God. All right. Well, Mr. Holtz, for those who want to follow along on this epic 3 years as we climb towards the big 6-0, you should be following him at Bolty-Boy, one of Twitter's oldest subscribers. You seriously do have one of the oldest Twitter accounts, don't you? I feel like you should.
No, I think I started in 2000. I'm in 2008. Maybe.
Oh, okay.
I think it started in early 07. So I'm in the first 6 months of a year. It's older than your Clubhouse account anyway.
Oh my God, my Clubhouse account, please. It's there. I was actually on it before you. I just haven't done anything. Instead, I'm focusing my efforts on my Twitter handle, which is @JessTomasa. And we have a special guest who has just popped in.
That's all right. Ellen will we'll have to do the end.
All right. Well, while we all look at Ellen's living room, I'm just going to close this thing out. So subscribe to thehealthcareblog.com and get these Healthing 2.0 O's and whoever decides to pop in delivered directly into your inbox once a week on Fridays. It'll also have in curated content from the blog, my WTF Health interviews, and more. All right, Mr. Holtz, let's say goodbye to Ellen, or let's say goodbye to Ellen. Ellen, guess what? You're on our show right now.
Well, I didn't know
what? Exactly.
All right, Jess. We'll be out of here.
See you guys soon. Bye.
Bye.